Alright, welcome. In this video we're going to cover how to do end to side anastomosis with a freely movable donor, right? So we're going to be able to move this back and forward instead of being fixed like in the other video. In front of me I have all the materials needed to do this procedure here, including the sutures. You know, we have a marker, we have our DeBakey forceps, two different types of needle drivers just depending on your preference, some mosquitoes to be able to hold the tail of the suture, and then we have our Mayo scissors. All the instruments needed to do this procedure are linked down below. Alright, for something like this, I'm going to go ahead and choose a small monofilament like a nylon. This is not the correct needle that is needed in a real life procedure, but this is all I have. You would want a taper needle to do something like this. Alright, before we begin, we got to make sure we plan our surgical incision. In this case, we're going to start somewhere in the middle of the blood vessel, and we have to figure out what angle we're going to connect these two blood vessels, right? We're just pretending here, but you just want an angle that is going to allow for less sort of strain on the donor, of course. So let's just pretend like this is the right correct angle, in which case we're going to go ahead and mark first the apex somewhere in the middle of the donor, so it's going to be there, and we're going to try and make a horizontal line all the way across, so it's going to be somewhere around there. All right, and then this is how we're going to cut this donor in order to make sure that it's the appropriate angle for what we need. I'm going to angle this tip upwards, that way it connects nicely. Alright, so we cut one end. Now let's go ahead and make this incision. One thing I did forget to mention is you might need some sort of a scalpel in order to make an initial incision just through one side of the wall. There you go. The rest of the incision is going to be done by introducing our scissors here and cutting along the line. Right, this suture here is very fine, finer than a strand of hair, so you got to be very careful whenever you're manipulating this. So there's so many different ways of doing something like this, in which case I'm going to show you how to do it in a continuous fashion. And whenever I'm doing something like this, I always like to start at the apex, just because it allows me to do one full circle instead of starting somewhere in the middle. But you could theoretically start here, in which case you're always going to start by going into the recipient end. So going down here or here, but you still have to do the full circle. So because we're doing that, you know, for an efficiency standpoint, I'm going to go ahead and start my first bite here at this apex. Because I'm right-handed, I'm going to start at the right side. If I was left-handed, I'll start it over here. Because I went from the outside to the inside, now I have to do basically the opposite. I have to go from the inside of the donor to the outside. So I'm going to go ahead and reload, and that's going to be right here. So I'm going to try to grab it very close to the edge and come out right there. Now I'm going to go ahead and protect my needle so we can get the procedure started. Okay, this is a good time to go ahead and grab the tail using your mosquito forceps, and then you go ahead and clamp it right there. Okay, now because this end is fairly movable, you can go ahead and move it in any way that is the most helpful for you, in which case, you know, you can leave it there, or you can go ahead and manipulate this side and move it to the other side of the blood vessel. That way you have access to this wall right here, in which case now it's kind of the near wall, right, instead of being the far wall. Okay, always being very careful to know what side of the blood vessel I'm in. I'm on the outside of the donor, which means I need to go the inside of the recipient here. So I'm going to go ahead and go here. I'm going to take this in 2 bites, and I'm going to take the next bite right there. Tension is really key for a procedure like this. So just got to make sure that the whole time you're maintaining constant tension as you're doing this. Having a partner helps tremendously with something like this, but in this case I'm by myself, so I'm just going to create tension. This mosquito is going to help you create that tension throughout the procedure. So I'm going to go ahead and kind of reflect this upwards, being very careful to not crush the blood vessel. Just slightly open it up, being very close to the wall here. And I'm gonna go ahead and advance it. So I came across this way, so I'm gonna come across where I bit, and I'm just gonna lightly advance it to the other side. From then on, I'm gonna go ahead and continue the anastomosis all the way down to the apex, because that's the apex is always where it gets tricky. So I'll meet you there. So I'm basically at the apex here. I'm outside of the donor vessel. It means I need to go on the inside of the recipient. Whenever you're doing these plannings, it is important that you leave it slightly longer on the recipient end. In which case, I probably left it a little bit too long, as you can see there. But that's okay. You know, this is all for practice anyway. And then I'm gonna take this backhanded in order to go through the apex here on the donor. Just like that. Okay, so from here, always paying very close attention. So I'm outside of this one, which means I need to go the inside of this bottom blood vessel. And here's my technique. It is a little bit uncomfortable, but this is important. So I'm gonna go ahead and reflect this with my debaki forceps on my left hand, and I'm gonna take a backhanded right there, just like that. And I'm always coming across the blood vessel, so I'm coming across and I'm biting here, and I'm gonna go diagonal into the next one, and just follow that pattern all the way across, so like this. And then I'm gonna come out right there. Pulling tension as you go along. Now I'm gonna go directly across this one and go diagonal right there, trying to be close to the incision. Doing your best to do so. Okay, so I'm gonna fast forward this and come out at the very end. Alright, here's where it starts to get a little bit tricky, just because it's really hard to insert your debaki forceps to make sure that you're only going through one wall, in which case you can use this the suture here on the left hand side in order to create some sort of counter traction, and just very carefully going through the walls, just to make sure that you're not piercing anything else other than those two things. I'm gonna go ahead and take one more bite here, and then I'll be done with the anastomosis. That way I can be exactly on the other side. So counter traction, I'm going in 90 degrees. I'm gonna rotate and come out right there. At this point, I'm gonna go ahead and protect my needle. Make sure that's visible, good. So you can either do a hand tie or whatever way you want to close these two things together. make sure you throw quite a few knots here, just because it's a monofilament, and they usually have memory, so it's important that you tie enough knots here in order for it to not come apart in the future, since this is a permanent connection. Alright, once you're happy with the results, go ahead and grab your mail scissors and cut, leaving about maybe a half a centimeter in length, somewhere around there. And here you go. Here's the finished product. So at this point, I'm just making sure that all the sutures, you know, they're nice and neat. Everything is coming together quite nicely. I'm gonna go ahead and cut into here just to inspect a little bit more and see how it came out. All right, overall, quite happy with the results, and that's how you do an end-to-side anastomosis with a freely movable donor. I hope this video is helpful. Thank you a lot for watching.